We were discussing anxiety. Another type of anxiety is social anxiety disorder. It is characterized by overwhelming fear of being embarrassed in everyday social situation, and leading to a patient to avoid such situation and avoid even meeting people that he was felt happy with even before. Social anxiety, where person has excessive and an unreasonable fear of social situation. Sufferer has fear of being judged, observed, or criticized. Anticipatory anxiety, common when there's fear of situation or events in days or weeks, even in advance. Person goes through social situation with an extreme discomfort or simply avoids them. This is what social anxiety disorder in short is. And here are some very famous celebrities which had social anxiety disorder. I have taken for the next few lines from a magazine. Um, uh, Adele, she is a very famous singer, and no one can imagine that once she was so much afraid of facing the public that in one concert in Amsterdam, she just says that I had to run out of the fire exit to breathe, to calm myself, to get back, to hold myself back. No, it just doesn't end here. Um, this is about panic attack. Emma Stone's words are, I was sitting in my friend's house and I thought the house was burning down. I called my mom and she brought me home, and for the next 3 years it just wouldn't stop. These were the feeling for me. It's a feeling of a patient who's describing a disease. But since she's a celebrity, so I thought it would interest all. Um, this is a scene from Macbeth. Lady Macbeth and Mr. Macbeth kill the king, and she wakes up at nights and feels that her hands have blood on it, and she feels anxiety and has to rub her hand and wash her hands and even bite her hands. This is a this is the first example we have of OCD. Remember, just imagine the greatness of Shakespeare describing obsessive compulsive disorder in 1500 and something in his play Macbeth. And this is Lady Macbeth who's up all night with anxiety, rubbing her hands, and she's unable to uh, cope up with the anxiety that she's getting. Obsessive compulsive disorder is a chronic and long lasting disease in which a person has uncontrollable recurring thoughts, obsessions, and behaviors and compulsions. Patient gets thoughts. It is an OCD cycle. Let me explain you through this. The patient gets obsessive thoughts, which give him anxiety. Then he has to do a compulsive act to temporary relief that's anxiety. In the example I showed, the obsessive thought is there's blood on my hand, which is giving the patient anxiety, and the compulsive behavior is that it is one rub or shampoo or wash her or his hands, and this will give her temporary relief. But this cycle doesn't end here. Again, there is such obsessive thought and anxiety, and this OCD cycle goes on and on and on, and patient is in real problem, and sometimes life and everything is hampered. Environmental factors can be there, temperamental factors can be there, genetic and physiological factors can be there. All these things can add to it. um, program If a patient is married, if a patient is unmarried, low socioeconomic status, unemployed, having other mental illness, then that's a poor prognostic factor. If he has a family which is supportive, and he has less stressful life events, and we can trace it back to some particular thing, uh, then we have a better chances of getting OCD better. These are against the same thing. I'll just skip through this. Um, if there is major depressive disorder is coexists. If there is bizarre compulsions, acts are and there have been previous hospitalization or need of hospitalization and current situation, then all these are bad factors. Good factors would be uh, family support, good occupational functioning, and all these things. Then there are certain neural explanations for this, that certain levels of serotonin, abnormal levels of serotonin, a neurotransmitter, is involved in this. So basically, our first choice is selective serotonin reuptake inhibitors. I won't go into this detail. This will that I have to give to my students in final year tomorrow. I'll just skip all these slides. DSM criteria, which is I told you, like Bible for criteria for us. It is recurrent obsessions are uh, presence of obsessions or compulsions or both. Recurrent or possessive thought urge which causes anxiety and distress. The individual attempts to ignore or suppress such thoughts, or to neutralize them uh, with some action or with some compulsive act. That is the big hallmark of um obsessive compulsive disorder. Um, there can be many types of obsessions and compulsions, like hoarding behavior, uh, keeping things which are years and years old, and you keep them in your locker or safe or your store. And then some people are obsessively um, concerned with symmetry. Everything should be in order. They get home, they put everything in order. Until they do so, they are unable to get easy or feel relaxed. Um, then harm related symptoms, some checking about harm. You get somebody gets up at night 5, 6, 8 times to check that he is locked, and then somebody comes back twice or thrice after leaving home to check the stove is off. And then as the contamination system of germs, uh, uh, symptoms of germs, and washing, cleaning, showering again and again, all these are um, obsessive compulsive symptoms. And these are again mainly again these things again. I'll just go through it. um, Again, medical integration, use of medication, which is with the SSRI, our first choice. If patient doesn't respond to first SSRI, we add another SSRI. I'll just show you a slide here how it's done for the medical students. Anti-anxiety medication can help you the sleeping pill in layman terms that you call it. Group therapy, in which a lot of people with the same disease sit together and share their painful experiences so that other can learn without going through the same painful experience. Individual therapy, one-on-one psychotherapy, cognitive behavioral therapy, trying to bring them to reality, and then trying to ask them to hold that compulsive act for as long as possible. And all these things help. This is a basic chart which I really follow for the first you get first you get give selective serotonin reuptake inhibitors. Then you have to give a second SSRI, then you give a third SSRI. If you don't get any response, then you switch to an antipsychotics, second generation, basically, like risperidone, olanzapine, um, ondansetron, and buspirone can also be given. Clomipramine is obviously reserved for augmentation purposes. If SSI is not working and there is a partial response, then you augment it with clomipramine or memantine. This was a bit for medical students or psychiatric trainees. Obsessive compulsive personality disorder is a mental health condition that causes an extensive preoccupation with perfectionism, organization, and control. Obsessive compulsive personality disorder differs from obsessive compulsive disorder. That obsessive compulsive personality disorder, like some people say Amir Khan is a obsessive compulsive personality disorder. You can say perfectionist, getting things exactly the way they want things to be. That is an obsessive compulsive personality disorder. Um, and that is a bit different from OCD. And in OCD, patient is in real pain and trouble, and he wants to seek help and wants to take medication. While OCPD patient think he's a perfect, and doesn't need any kind of a treatment. So it's difficult to bring OCPD, obsessive compulsive personality disorder patient, into treatment. Um, anyways. This is again about OCD and OCPD. That if OCD and OCPD do both combine, then it's a more severe kind of problem that we face. Kleptomania, when it's basically an impulsive disease. It's not related to anxiety, but when you try to control that impulse, you get anxiety. So kleptomania, where people just steal for this fun of stealing, or just for they have no personal gain. They are rich, they have everything in life, but they still go on stealing, um, to satisfy that anxiety that they get. Shoplifting for no reason, just to for fun, or just to have the thrill of it. But if you do, kleptomania patients are so much into it that if they don't do it, they get anxiety. It is not an obsessive compulsive disorder, but it is related to obsessive compulsive disorder, and it is a one of the causes of kleptomania is obsessive compulsive disorder. Trichotillomania is simple, where you pull out your hair and eat it. And that's also an impulsive disease, and if they don't do it, they get anxiety. The history of OCD, first thing we get is in church writings in 14th and 16th century, where the term scrupulosity was used for the people entering the church and thinking of their sins and the previous life, and doing over compensation by over rituals, and by sometimes hitting themselves even. That is the first kind of writing about OCD that we get from the 14th century church writings. And then obviously, as anything in Sigmund Freud is from 1856 to 1939, has a great contribution towards this, towards understanding of OCD. And uh, and ultimately, in the 19th century, 20, 1877, this is the first time Carl Westphal uh, described OCD related symptoms. And in the 21st century, we have complete picture of what, and knowledge of what OCDs are. A few celebrities with obsessive compulsive disorder. I try to keep it for, because students listen to the lecture more, and they are interested when you tell them that David Beckham has OCD. They would definitely listen. So it was in a magazine that David Beckham says that when I enter a hotel room, before I get everything properly placed the way I want, I cannot sleep. This was in the Independent that he gave interview. He admits he's constantly working on to control his OCD. And then a strange type of OCD that Leonardo DiCaprio has. Um, he says that I have to enter doors in a certain way. If I that I feel that it's I have I have to, that all the evil things or the evil uh, taboos are driven off. And if I feel it's not, I go back and I enter the door again. And that's kind of OCD that he has. And he still played OCD patients and psychiatric patients in a few movies, like Shutter Island. Um, Even Katy Perry has admitted in UKLA magazine that she has OCD traits. She has the problem buttoning everything, and she blames it on her poor childhood and um problematic childhood. Thank you so much.